Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Anita Shannon, who appears at national conventions and presents workshops on ACE massage cupping and MediCupping since developing these brands of bodywork in 2002. She has published numerous articles and comprehensive educational videos on vacuum manual therapies, and was inducted into the Massage Therapy Hall of Fame in 2011. Let's listen and learn as Anita shares ACE cupping therapies for surgical prep and recovery. She'll discuss specific vacuum therapy techniques and review interaction with the medical community, joint replacements, breast surgeries, face and neck procedures, vascular surgeries, along with lymphatic work using manual equipment and machine use to prep surgical patients to potentially delay, avoid, and ease surgical procedures. Again, thank you for joining us tonight. Feel free to chat questions and comments during Anita's presentation, which we will answer at the end. And Anita, welcome. I know you have a lot to get to tonight and share, so I will sign off and see you on the other side. It's all yours.
Thank you. Thank you so much for hosting us. Thanks to Biotone. This is just a wonderful education program. So we're absolutely thrilled to participate. I'm here to yak about surgical prep, and you're going to get some articles with the recording. One of them is a reprint from Massage Magazine, because one of my special loves really is breast work. This is something that we really need to promote for healthy breasts, women who have the dense breast tissue diagnoses. A lot of women that we've worked on who had dense breasts, and I'm sorry about the quotation marks, but some people really truly do have dense breast tissue. But a lot of women are being told this because the laws changed a year ago, that if you do not tell a woman she has dense breast tissue and something goes awry, that you could be held liable. So for the first time in my whole life, I got a diagnosis of dense breast tissue. I'll be interested to see my next scan, because I've been working on decongesting the breast tissue. To me, I think a lot of us, and we've been able to prove this through women going and getting thermography and mammograms, things like that, and all of a sudden the diagnosis changes. They don't have dense breast tissue anymore. I have a feeling it's just a misunderstanding that this is lymphatic congestion. So not only is our love breast health, which if you decongest the breast and really help the lymph to move out, it's going to create a whole different environment. It's going to be an oxygen-filled environment. It's going to be alkaline. So breast cancer can't really proliferate in that kind of an environment. So prevention to us is a really big thing. And we're hoping to very soon launch a home care program and have little machines that women can have at home once, twice a week. Just decongest the breast. It takes a lot of the weight off too, which is really nice for a woman who's hunched over from so much anterior weight. The work on the back is amazing. And getting to that with surgeries now, breast surgeries I'll start with. I'm sure a lot of you have worked on women, especially who have had breast surgeries, maybe a couple men who had breast cancer, but we can do some amazing things to loosen restrictions, which seems to be one of the biggest problems. Encapsulations. I know women who have to go in and manually have their breasts grabbed and popped because these encapsulations have occurred around the implant. We can take care of that without that approach. It's a different approach that we use, but we can relieve that quite quickly. And they don't even need to see us as often as they had to go to the doctors. So there's contractures, there's all kinds of things that these women end up with after these surgeries, whether it was for breast cancer, whether it was a reduction, whether it was implants, reconstruction, whatever it was. So that kind of crosses over into a lot of the different surgeries, like hip replacements, shoulder replacements, things that we're dealing with a large group of us that are baby boomers, and we wore out our hips and our knees and everything else. As a matter of fact, one of our staff members just had a knee replacement a few weeks ago. So I've been giving her little tips, working with the magnets to change the polarity of the tissue to help the body heal better, reduce inflammation, reduce swelling. So she's got this really big inflamed knee. And when I talked to her, I think she didn't hear it when I said, please don't suction those onto your knee because it's going to hurt. And she tried it that way and it hurt. So there's ways you can hold them in your hands and just hold them over the areas and do what you want to do. But the magnets are always kind of a go-to for me post-surgery. Pre-surgery, to me, really the most important thing is that lymphatic drainage. If you're getting a vascular surgery and you've got this enormous congested, lymphatically challenged leg, why would you not want to? Oh, you don't have audio or video. Okay, we'll see if somebody caught that from Biotone, see if they can fix that for you. So you can't hear me at all. Can everyone else hear me? Okay. Can someone just write me a message? We can hear you. Yes. Okay. All right. Sorry about that. You might have to log out. All right. Good. Thank you. Thanks for letting me know. Again, my question is facelifting, vascular surgeries, even bariatric surgeries. Those are the most fun people to work with because a lot of what they think is fat is the same thing. It's congested lymph, what I call solid bloat. And so we've been able to help people who wanted the surgery but were too overweight. The doctors wouldn't do it until they lost, 60 to 100 pounds. And just doing lymphatic drainage on them, we were able to get anywhere from 20 to 30 pounds that dropped off in the first few weeks. But it was lymphatic weight, it was waist weight, it was water weight. It's stuff that needed to get out of there before this bariatric surgery is done. And of course, once they've had the surgery, we need to help them with lymphatic challenges as they recover and start their new life, with a much smaller stomach. That's my whole question with surgeries, is why people are not getting pre-treated, not getting the lymphatic. I think I have a cat hair or something here. Why they're not getting treated prior to surgery. And we treated a couple of people like James Waslowski. We were able to get him in before he had his hip surgery. People recover better. The doctors are absolutely thrilled because the bruising is less, the swelling is less. So somebody who's doing a facelift, and you know how people look after they've had a facelift, it's pretty horrifying. Most of them hide for about a week. But we found if we pre-treated them and drained all of this and got the lymph system functioning again, they did not swell up as much. They didn't bruise as much. The doctors were thrilled. So we've trained people in physicians' offices to pre-treat people, even if it's 2 to 3 treatments every 2 to 3 days. And that's the important thing with this pre-surgery lymphatic work is we have to only do it twice a week. If we go in and do more, we basically override their whole lymphatic system. And that wasn't the point. What we want to do is enable it, assist it, decongest it, and get that system running again. You know, with some people, there's so much buildup. I mean, it's just been 20, 30 years where it's just been blocked up and not draining correctly. And they wonder why they're getting bigger and bigger and swelling out. And a lot of it is lymph. So, I mean, working with doctors, the best thing is to present some before and after photographs, even if it's not somebody who was pre-surgery, just someone that you did a facelifting and drainage maybe twice a week for 3 weeks. And take your after pictures, maybe take one in the middle. Physicians really respond more to pictures than anything, before and afters. They don't want text, they don't want articles, they want proof, before and afters. Someone made a comment to us that we need to do some scientific studies because our work is not based on Chinese medicine. Ours is very different from regular cupping therapy. There are really very few studies out there. We'd love to do that. So we might be getting something together, but at the same time, we do have some really great case studies that have shown significant results for people. And for me, the biggest thing is when a doctor calls you, you know, and comments on what an amazing change in their patient. You know, we are an adjunct, we're an allied therapy. We're not an alternative. We're complementary allied therapies for the medical field. I don't consider myself an alternative. I'm not an alternative to breast surgery. I'm there to help pre and post for the person's recovery. So the doctors do like us, but the evidence really is, I don't know why this is not charging. The evidence is really in the pictures for the doctors to look at. Sorry, I just lost my power and there it goes. Didn't want to disappear on you. So that's the excitement, is working with physicians to initially approach them. We really need evidence. We may not have large studies of a large number of people, but if we can show them pictures of the people we've worked on and what we've been able to do, and that's convincing right there. Then I ask them for maybe 4 to 6 of their patients. Would they consider sending them over? And I usually do a discount on the price and everything for them, and do a little study on maybe those 4 to 6 people. They go back to the doctor and the doctor sees the difference immediately. One woman, after her breast surgery, went to one of our practitioners and he did amazing work. I mean, it was so different. Her pain levels went away. She had a reduction because she was just enormous. And so her back needed work, everything. It's not just the breast. We have to kind of work the whole, everything, all the lymph, all of that. But she went back to the doctor and the doctor was like, oh my gosh, you know, your scars look amazing. This is amazing. We have to take some pictures of you for, you know, the website. And she looked at him and she said, if you take a picture, you have to credit this practitioner on your site, because this is a combination of both of you. She said, you know what I looked like, you know, 3 weeks ago. So he did. He put the practitioner credit under the photo. So they are extremely open to it, especially when they see the results. To be honest, they don't want to read a study. They don't have time. They just don't have the time. A lot of people in my family are physicians, you know, and they're, you know, 2 o'clock in the morning still going over their cases. So they really aren't going to be looking at large studies, things like that. They want to see pictures, if that makes sense to everybody. After recovery is the different part. And one of the articles you're going to get is going to talk a little bit about scar tissue. But what we can do for all the different scars. I mean, I can't wait to get to that one from our staff member, because look at here, just like, we can really help them disappear. We can help change the texture. We can really help with any kind of attachments that have grown out, where it starts attaching to either bone, other tissue, things like that. And again, you've got the fascial damage from surgeries. I mean, no matter what, they're cutting through fascia, and that's going to affect everything afterwards. Because if you have never seen this before, if you could look at something on YouTube, it's called Strolling Under the Skin. And if you watch that, I usually watch about the 30 or 40-minute one. The cadaver stuff in the beginning might be a little difficult to get through. For me, it was pretty fascinating, but stay in it, really watch. They've got a camera under a live person's skin showing the fascia and how it works, the microtubules, the fluids, the hydraulics, and how this amazing geometric web, three-dimensional web. So just think of that. Once you cut that, you've interrupted that flow of fluids, of hydraulics, and just of the strands themselves. And repairing, you really can't do much for that, but you can really free the strands up. You can, because they're going to compensate, they'll figure it out. But if we can get them unstuck from the surgery, because it's hot, it's inflamed, it's going to stick them all together. And I'm just going to jump back to pre-surgery. If someone has fascial restrictions, I would prefer to pre-treat them and change that if possible, because I don't want somebody with, a pronated leg, inward turning leg, because of a fascial restriction down the medial leg. Why would they want to go into surgery like that? We want the fascia so that the leg is actually in the right position, and that the fascia doesn't pull that back out of position. I hope that makes sense. So when you're using the cups, which is really fun, you hear like this bubble pack, underneath it, like everything's popping. And that's actually the fascial strands separating and popping open and becoming free to move again in their geometric design. So for pre-surgery, it's lymph and fascia, to me, is really, really the most important. Also, just through the vasodilation we create with the vacuum, it gives the body a way to eliminate any inflammation that's in there. I'd like to get that out of there before surgery, because more's coming in. So tilt my head back or something here. Those are my two main concerns: are fascial restrictions, three, inflammation, and lymph. Pre-surgery. After surgery, it's inflammation, restrictions, scar tissue, things like that. With breast surgery, sometimes when they do, like little slings and stuff under the breast, tissue, things like that, some of the latissimus flaps, which they're not doing anymore, very thankful for that. But we can really help with the pain levels, we can help with the restriction. Usually the rule of thumb is 8 weeks after surgery and we can go in, but we have gotten permission to go in at about 4 weeks from the surgeons that have worked on these patients. I always send the notes to the surgeons too. Every treatment this person gets, before and after, I just automatically fax, in a secure, they've given me a secure way to fax it, and send over the notes to put in the file. The doctors really liked that. I mean, that was something really different. They had never had a massage therapist send treatment notes. I mean, why not? Including measurements, range of motion measurements, things like that. Those are very important. So I do have my little square grid on the wall, and, do before and afters and all of that stuff. So post-surgery, is usually longer treatment than pre-surgery. We don't want to overstimulate the area. So usually it's anywhere from 2 to 4 treatments, depending on the person and what kind of shape they're in. Post-surgery may take us a while. It depends. The woman that's in the article that you'll be getting from Massage Magazine, it was published in Massage Magazine, I should say. She had a very unusual breast cancer, and they had to remove so much tissue that there wasn't enough skin or tissue left for her to get an implant. So she was kind of accepting it, but we decided to take her on as kind of a case study. It took me 18 months of seeing her twice a week, but we made the space. We stretched the skin. You can do it with the expanders in. I've worked around expanders, no problem. Just before you work on people like this, you'll need to study breast structure. I mean, we do whole institutes, and we do about 2 of those a year. We're trying to do more. We're actually might be opening 3 breast care centers in Texas, North Carolina, and Georgia. So we do these institutes, and it's 5 days, 4 to 5 days of just working on women, learning about breast structure, learning from these people who have worked with so many different cases, because you'll be amazed at what'll walk in there after some of these surgeries. One woman, I think this was the point I was making earlier, one woman came in and her implants looked square because of the tissue they had put under it. Another woman, when she would do this, her implants would pop into her armpits. Not funny. I mean, she laughed at it. She thought it was hilarious, but you know, the squares, all we had to do was go in and loosen certain parts of that support. Can you repeat the recommendation? I'll catch that one in 1 second. I'll check what that was. So what we did is we just looked at hypertonic tissue and hypotonic tissue. So I released the hypertonic and strengthened with pumping the hypotonic. And at that point, her breasts went into the right shape. They weren't square man-looking breasts anymore. And it took us about 10 minutes, and that was it. So you're going to see some really fun results from this. The woman with the ones that popped into her armpits, that took us a little bit longer, but we did get it to stop. All right, where's the chat? Hey, change, there it is. All right. Can you repeat the recommendation for a person to have care before surgery, please? If the treatment is massage or cupping. It's both. It's massage cupping. So my hands are always in there, but most of the work is with the vacuum cup. And a lot of it is working around the base of the breast first, and then working up towards it, and then eventually putting a large cup over it. You know, but first we'll need to pre-clear the axilla, pay attention to lymphatic pre-clearing before you do that. So care before surgery, biggest focus is lymphatic congestion, inflammation, and fascial restrictions. I really think that's, you know, that's my 3 key ones, you know, for most of the surgeries. Mine used to do that after the surgery. Massage cupping was the solution. It's great after surgery, but we got to remember to prep people. Again, I just see women going in, oh, I'm getting a facelift, and their face is like out to here. It's all swollen up. They don't have a neck. And it's like, you know, please, can I pre-drain you? Because, you know, as soon as they start doing those incisions, they're going to swell up even more, which is going to stress the skin. It's going to take a long time to go away because they have a restriction in their neck or something. I am finding so many people that had their umbilical cord wrapped around their neck when they were born. And it's weird. They're in their 40s, 50s, and 60s. I can still see the dent. And they've got all of this lymph above it. And all you have to do is find that restriction, remove that little dent, I'd like to remove a few wrinkles, and get that draining down again. I just don't understand going in and surgically approaching the body when there's an enormous amount of congested lymph in there. So that doesn't make sense to me. How many weeks before surgery can they have treatments? Wow. We actually found someone to work on James Waslowski the morning before his surgery, and that was simply because his schedule was so rough. Normally, I wouldn't do that because I don't want to stimulate the blood flow to the area and stuff like that. So I usually work on them the day before. If it's somebody who is going for bariatric surgery and we need to get some weight and lymph off of them, they might be coming to see me for 6 weeks. And even then, the doctor usually hasn't scheduled their surgery till they see if this actually worked. All right. I do not know why my battery keeps doing that. I have this thing plugged in. So I will find another outlet. Sorry about that. Oh, you get to see Foghorn Leghorn. That should take care of it. Sorry, I'm having some electrical issues here and I don't know why. All right. Anyone in Arizona? Are you asking if we have practitioners? I'm sure we do, because I have trained people in Arizona. There is an amazing, amazing instructor out there, Beth Ellen Zhang. She has the Sedona College. She's out in, she was in Sedona. She moved to Cornville. Amazing. And if you have some serious stuff going on, she is one of the most amazing people to go to. So yeah, we do have people in Arizona. All right, I think that was it on all the questions. You're from Arizona, great. We've got a lot of practitioners. We probably trained about 20-some thousand people. I mean, we've been doing this a long time. We started in 2002. So are there any other surgeries that any of you are working with that you want to ask a particular question about? Donnell just said the same thing. Oh, I'm getting close on time. Knee, tummy tucks. Oh, yes. Yes. Thank you. Deep flap. Any contraindications? Partial hysterectomy? Ooh, that's an interesting one. Okay, tummy tucks I'm going to start with because that's just super cool. Oh, look at this. Hiatal hernia. Oh, yeah. Any of the laparoscopic surgeries where they inflate us, it actually exits right through here. Usually on the right shoulder, some people left, but usually there's intense pain here. I will go back to the I'm definitely going back to the tummy tuck, but wow, lots of tummy tucks. This is great. Wow. Okay, contraindications, how soon? Okay, how soon after surgery? 8 weeks is the norm, just for the scar to heal up. Tummy tucks, and let's talk about C-sections. And I don't care if this was 25 years ago. Check that C-section and the tummy tuck. It is inhibiting the lymph flow from the abdomen down into those upper inguinals. So a lot of women end up, even after the tummy tuck, with a little bloat and it's lymph. So we just have to retrain that lymph to go through that scar tissue, soften the scar tissue so it doesn't indent like it does and attach to the abdominal muscles. But approach people first with a suction and release, which is why I love the machine, because I don't have to do that manually. But I found if I do a glide or a twist or anything over that scar tissue first, it hurts. So I always gently just open it up, and then I start watching through the cup because I want to see where the big dents are. I had somebody in class in Chicago last week. She had had a C-section and it was beautiful. I mean, it was just beautiful surgery. And then somebody went in with vacuum. I don't know who they trained with. And they actually, the skin stayed intact, but behind it, the incision split open. So now instead of this really beautiful flat scar, couldn't even see it that she had, now she's got these big dents in it where you can see the tissue underneath separated. There's nothing that can be done for that. It's like a small herniation in the abdominal muscle underneath the skin there, the scar tissue. So that's hard to see. Gently. I mean, all of this, we can get where we want to go gently without doing damage to people. Contraindications for this work. Again, anyone who bruises easily, is on blood thinners, a good rule of thumb is if it's contraindicated for massage, it's contraindicated for this. The one thing we have to watch is when we do lymphatic drainage, we move so much because we're using a vacuum and we are moving large amounts, where when I did MLD, we were stimulating the superficial lymphatic system and that would activate the deeper, and it was a slower process. We're moving a lot. I mean, I've had people get off the table and run for the bathroom, just they need to eliminate water. It's a wonderful thing to see, you know, that we can help move all of that. But if somebody has kidney issues, if they have diabetes and their kidneys might be weak or their heart, yeah, I'm going to go very gently, maybe only work in quadrants for a little while. Less is better. It really, really is. Any other special contraindications for us, the work we do? If you're going to apply heat or cold, please do that before you do the vacuum work, not after. And it's because you've created all this vasodilation. And if we put cold right on that, it just shuts it all down and the cold travels in even deeper. So if I'm doing lymphatic work, yeah, I'm going to be using some moist heat, you know, some infrared, you know, heat, things like that to help soften it up. And then when I go in with the cups, it's even easier. My favorite thing for myself lymphatically, and I could use a little bit of that, body everything I do in the shower. So I get in a nice warm shower, not overly hot because I live in Florida. But that starts everything going, you know, do the whole hair thing, and then I'm ready to start draining and getting this lymph moving out. And it's really fun, and it makes it easier because the warm water has already started liquefying it a little bit. It's really hiatal hernia. We can't go near hiatal hernia because, you know, we did, I did work with a doctor, but she was in the room because she wanted me to actually pull the stomach. It had looped up through the herniation in the diaphragm. So she wanted me to gently pull it back down, and we actually did. But I won't do that unless the doctor's right there. And with new, you know, my little machines, I can go to their office really easily because they're not going to come to mine. How long after? Ooh. How long after tummy tuck and abdomen lipo can you do the colon treatment? You mean how soon? Okay. Again, pretty good rule of thumb is 8 weeks. If they are severely backed up though, you could go in with very gentle stimulation and then look at the back and look at the innervation that comes out of the spine to the colon, work that. You could work a little bit along the face in the colon zone, the hands, the feet, but I would wait about 8 weeks to go in directly over it unless they're having some issues and they're backed up, then you got to do something. I also recommend they just take like a big tablespoonful of olive oil, and that tends to help things move out a little bit. Quadriceps tendon after, ooh, craniotomy. Ooh, I have not worked with a craniotomy. So if the person has hair, this could be a problem because we won't be able to get in except with really, really tiny cups. But even then, I mean, if you can get in between there and, you know, do some work, that is really, I'd like to dig into that one. That one's interesting. Knee replacements. What is going on with their quadriceps tendon after the knee replacement? Did it go hypertonic, hypotonic? Is it torqued? So I have to have a little more information on that one. The craniotomy, I've got to look up and just see lots of restrictions in the scalp. Oh, the nice thing with the machine is I can actually get suction. With manual cups, forget it. I won't be able to do it. But I just kind of part the hair and get in where I can, where the restrictions are. I've been working more with people, not from a craniotomy, but, you know, an injury. And they had some issues going on in their scalp. So we worked on that. So no liniment, yeah, you bet. Yes, definitely. Jingouche, my favorite. That is one of my favorites. Yes, that's more of a chemical heat and cold, where the mechanical one really raises vasodilation. The products usually don't do that. You get the sensation and all of that, but it doesn't seem to have the same effect. We've tried that. My favorite is, let's say I'm dealing with golfers or tennis elbow, you know, medial lateral. And so what I'll do is do the work around it, work with the tendons, you know, do a lot of movement with the arm, work with all the structures, do the drainage, because, you know, there's going to be inflammation and stuff in there. And then I do Zengouche or a couple other liniments that I love. You could do even, there's some aspirin based things. There's all kinds of great products out there. But then I take a towel and I cover it because I want that to really penetrate into that nice vasodilation I created. And I don't want it volatilizing in the air. So I kind of cover it and it keeps the vasodilation at the surface a little bit longer. So it tends to really absorb the stuff even more. I tend to yak away, so I'm checking to make sure I don't go over my time. Like last time we went 1 hour and 15 minutes. Oh, where do you recommend getting certified? Well, we run classes all over the country. We've got some great instructors, just fantastic. And then we have these breast institutes. I used to do special scoliosis institutes because that is like my absolute favorite thing, whether they've had the bars, the rods, I just love it. Because again, we can trace it back if it was not genetic, if it's not a malformation of the bones themselves. Very often we've traced it back to a really intense trauma, like falling out of a tree. One person, they fell down cement steps on their head when they were about 3 years old. I mean, you know, 3-year-olds were running around getting into everything. In 2 treatments, her back went right into where it should have been. You know, she still has all the hardware in there, but at least now it's just holding everything back in the correct place rather than forcing it. So we found amazing restrictions and injuries from those impacts to her head, the compression on her neck. And I mean, you can just imagine how that would create a scoliotic curve in the spine over years. Total ankle replacement. Oh my gosh. But yeah, come to one of our classes and it's really fun too. We do have really comprehensive videos out there. So some people start with that if they can't get to a class, but we still want you to come to a class. There's nothing like it. The class in Chicago, it was a nice small class because I kind of put it out there a little late. And so we were able to do the breast work because it was a level 1 and level 2 together. So we did a few minutes of breast work. So all the women in the class, we didn't have any men. So it was easy. And a lot of the women really felt a difference in the tissue. Can you talk? Ooh, magnetic cups. Okay. Hypertonic. Ooh. Oh, it's your own craniotomy. Oh, I'd love to talk to you, Maud. That sounds really interesting. What about the carotid artery, Susan? What were you asking? I need a little more explanation about what you're asking with carotid artery. Oh, the magnetic cups. Okay, Brooke has asked if I can talk about the magnetics. Oh my gosh, they are just the coolest. Love these things. Now there's a couple sets out on the market, and one of them I'm having, a problem with because it's really wonderful and it's made by the same company, but the poles are reversed and that's freaking me out. So you've got your positive and you've got your negatives. Now there's some other great magnets out on the market. They're big flat things and they're very expensive. I like these because I could place them down the spine for scoliosis and create movement. You can create a negative static field by only using negative. And what you're doing with that is you're switching the polarity back to negative, of course, and you are switching the pH from acid to alkaline. So we're supposed to be acid on the outside, alkaline on the inside. Most of us are not. We're incredibly acid in and out, or we're alkaline on the outside because products we're using, and acid on the inside. So it's interesting. So if I want to create movement or I want to create a bipolar field, that's when I will bring the red ones in. So these are positive. So they're going to create acidity. So you're never going to use these alone. That's the last thing we want to do, is create inflammation and acidity. The reason these are here is for a balancing field. So if I've got somebody like Diane who's got pain in her knee, and that's what the red is for. What that does is stimulates the body to send painkillers, all of that good stuff. So my suggestion to her was to put them between her fingers. This came from Garrett, one of our educators. I'd never thought to do this. I was just holding them one by one like this. So that's why we like having all our educators, is many great minds. So now I've got these between. So now I can just run them over. I mean, they are touching. I could even do them long ways. So I'm barely touching my skin, but believe me, I'm getting the charge. Other than that, and I just put those near my phone. Please don't put these near your phone or any electronics. The way they normally are used is they're just suctioned on. So for sciatic nerve issues, things like that, you'll see me doing a grid over the sacrum and then tracking red and blue down the nerve if there's pain. If not, just blue. I even use these for TMJD, and I have earrings on, but they should be okay. So I put them on there, traction slightly, and just do some movements, move down one, and right where that pterygoid is. So this is relieving a lot of the issues with TMJD. And well, that feels good. All right. Oh, nice. I'm glad you're inspired. It is so much. Oh, thank you. All of these massage trainers are amazing. I better take this off. We do have amazing people. Yeah, we pack an enormous amount in our class. The 3-day people walk out pretty wiped out. The 4-day, usually I'm able to help them balance out that last day with the magnets and stuff like that. Oh, anything for an anterior neck discectomy. Ooh. Quickly, I will answer this before I forget how to clean these magnetic cups. I do wash them. I just don't submerge them, because as soon as you get water up in this bulb, you're going to create some problems. So I wash them and then I wipe them down with my, now actually I don't. I put these in a liquid sanitizer right up to here. And then right before I work on my client, I wipe them down with the sanitizing wipe. I'm just kind of weird. about sanitation. I do also put these in my UV sanitizer. But remember, everything has to be clear. So what it's doing is sanitizing the exterior of this bulb, but it will go through this clear part and sanitize everything in there. So I don't worry about these too much. I wash them, put them in my liquid sanitizer, dry them, store them back in their case, make sure the ear poles are separated, and one just ran away. And yeah, do make sure the poles are separated though. And I actually put them in usually so they're facing away from each other because they're opposites. Fantastic. Ooh. Okay. Cavi wipes, disinfecting towelettes. I use 7th generation. It's the same as God, I'm sorry I didn't get to that discectomy. I can't even say it correctly. Please email me. I would love to jump in on that one. Yeah, come and take a class. They're a lot of fun. We use all kinds of equipment. And once you try the machine, it just really kind of blows your mind because it really takes a lot. You can see I gave myself Popeye arms from pumping so many years. Mm-hmm. But I think we'll have to stop. I want to answer all of them.
Well, let's work on answering them. I'm jumping in to help you because I think we skipped a few, and I want to scroll back to the beginning. There was one. Did we answer the partial hysterectomy?
Oh, a client lost inches of solid bloat with massage cupping. She was 6 years post tummy tuck. Thank you, Lori. That's awesome. Oh, ooh, tenosynovial giant cell tumor. Whoa. That will take a lot of time. Please email me on that one. That one we would need to be talking about for a little while. That is a great, wow. Wow. That's wow. Yeah, I need more information on that one. And do you know about TGCT? This is Kim. What is TGCT? A client that moved to Arizona should, oh, yes. Teresa, definitely look on our website. You'll find Beth Ellen Zhang. She's one of our educators. Your client would do extremely well to go see her. Partial hysterectomy and laparoscopic. Again, they are inflated for the laparoscopic work. You know, sometimes a little bit, sometimes a lot, depends on the doctor. What is going on after the hysterectomy? Is there pain? Is there restriction? Is she still bloated out? So again, Elsa, please email me on that one then. And I think we missed the deep flap. That one will go into, yeah, some of these are questions that we would answer in class, and it would take us about 15-20 minutes to do that. I wish I had my little mannequin set up and then I could show you some stuff, but we'll be doing short little videos. I did get a medical mannequin, so I quit dragging my poor neighbors onto my table.
Well, Anita, why don't you chat your email address where people can follow up with you on some of these questions. Tomorrow, everyone, there will be a follow-up. There will be a follow-up email with a link to the recording, Anita's contact information, the article handouts that she referenced earlier. And I'd like to also encourage you to visit the archive library for EduTalks on biotone.com under the EduTalk tab. Anita has presented 3 or 4 topics over the years, so definitely check that out. And let's see, I still see.
Yeah, the TGCT was the the tumor,
Tenosynovial giant
tenosynovial
cell.
giant cell tumor. The best for you guys that I have asked for you to contact me, because it will take, I have so many questions for you about your patient and what happened with the hysterectomy, what are their issues since it. The information you'll get tomorrow has info@massagecupping.com, but email me directly, Anita@massagecupping.com. And that way, but do know I will be at World Massage Festival all next week. So if I don't get back to you immediately, that's why. Sorry. Are any of you go? If any of you are going, please get on our table.
Additionally, Anita, will you be at AMTA National in Tampa this year?
You bet. I don't think we've ever missed an AMTA. We're missing FSMTA now, but they booked theirs right on top of World Massage Festival, and it made it really hard for a lot of us, to just go from one show to the other, because I love FSMTA. But yeah, go to some of these shows, guys. We're all there. We have tables set up and we work on you. That's how you get to meet the different educators too, and see who you really resonate with and who you like.
Exactly. And visit again the archive library for EduTalks, because there's over 4 years of expert talks with industry experts and educators. So I'd like to direct your attention there. And again, search through, find Anita's other talks, and just
It's a wealth of information you've
it is, and the
made.
community has been so generous to share information in these short time slots. So
We love it.
yes, I'd like to mention just quickly our upcoming EduTalks. July 16th, and for those of you who are not familiar with the EduTalk Diabetes series, these are, again, something you can find on biotone.com under the EduTalk tab. We'll have Michael Shea, who has presented for the Massage EduTalks previously. He will be discussing causes and care of type 2 diabetes. And on July 23rd, Brian Traskus will present Trauma-Informed Practice, an evidence-based approach to inclusive, compassionate, and holistic care. And August 6th, James Wislowski, and we can ask him about his cupping experience before his surgery, but James Wislowski will be presenting quick manual therapy techniques for musculoskeletal pain relief. So watch your inbox for invitations. Check the archive library on biotone.com. And if you are at the trade shows, jump on Anita's table. And lastly, Anita, do you give information on where to purchase like the magnetic cups? Is that also found on your website, or purchasing cups? So
yeah, massagecupping.com has all the equipment. We're adding a few new things in the next month. This super, super tiny little machine that's adorable, and I love it. You'll see that at World Massage Festival. And then I'm testing them out, these really bizarre cups that we found that have a handle on it. But I'm still testing them to see if they work with our techniques. So it's always fun. We're always adding something new. A lot of our educators write articles now, so you'll see new postings with that, the blog. We've got social media with people commenting. It's a lot of fun.
oh, that's wonderful. So again, watch your inbox. Join us for upcoming EduTalks. Thank you so much to everyone for all you do for the massage profession. And again, visit the archive library. And I was going to say something and I've totally forgotten it. So if I remember, I'll put it in as a PS in tomorrow's follow-up. But thank you, everyone.
We do have a course in process for the magnets. I saw a question. I wanted to answer it before we jumped off. Yes, the course is in progress. It's online and should be posted within the next couple of months, I hope.
Wonderful.
Thank
Well,
you.
you'll have to come back and present a focused EduTalk on magnetic cupping.
That would be fun.
And thank you so much. Lots of thank you. Excellent talk, Anita. Thank you so much. And I'll let you go, everyone. Watch your inbox for the follow-up. And again, Anita's email for direct questions is anita@massagecupping.com. Thank you, everyone. Be safe. Did we catch up on all the chats, Anita?
Yeah, and Carlene, yeah, I can't wait to see you in a class. If you've already got the machine, come to the class. It's so much fun. But you did also you should have gotten your 2-hour intensive video with that too, so you can get started. Thanks, everyone.
Thank you.
Thanks,
And
Mel.
thank you, everyone. All right, take care. We'll see you next time. Bye-bye.
I know I've been told it's tacky to wave, but